Hi, my name is Jillian Irvin, and I'm Legislative Counsel for Councilmember David Catania. For nearly 2 years, we have been working with Nardine Jeffries and our partners in the executive and advocate community to create the South Capitol Street Memorial Act. This legislation calls for the extension of behavioral health services to all public and public charter school students. It enhances truancy regulations to ensure needed services are delivered to youth and increases behavioral health screening at district agencies that deal with youth. Specifically, the Act's 5 titles do the following. Title I calls for a comprehensive study of the behavioral health needs of district youth. It will create evidence-based responses to address unmet needs and inform efforts to improve the current delivery apparatus. Title II requires the creation and implementation of a comprehensive plan to expand school-based mental health services to all schools by the 2016-2017 school year, with a ramp-up period in the preceding school years. Currently, only about 1/3 of schools in the district have behavioral health services. The plan will implement services at both public and public charter schools that include interventions for families of students with unmet behavioral health needs. Title III deals with truancy. The Act enhances the district's unexcused absentee protocols by focusing the first intervention, which occurs after the 5th unexcused absence, on the underlying causes of truancy and providing appropriate services. Mandating this root cause analysis will increase identification of youth with unmet behavioral health needs, and an added benefit is the less missed school days, the more likely a student is to graduate from school. The Act also allows the mayor to enforce protocol, which increases the accountability of administrators and teachers involved in preventing truancy. Title IV establishes the Behavioral Health Training Program within the Department of Mental Health for teachers, principals, and licensed staff at child development centers on how to identify youth with behavioral health needs and how to refer them to appropriate services. For parents and youth, the Department of Mental Health will create behavioral health resource guides. Title IV also establishes an ombudsman for behavioral health. This will be an office that will serve as an advocate for district children and parents. The Ombudsman's Office will help parents navigate the healthcare system. Title V addresses behavioral health practices in the district agencies that deal with vulnerable and at-risk youth. It requires all youth in CFSA and DYRS to receive behavioral health screenings within 30 days of their initial contact with the agency. And, if needed, it provides more comprehensive assessments by behavioral health professionals. It also creates a resource guide for parents who come into contact with the Child Welfare Agency or the juvenile justice system. Thank you very much for supporting this piece of legislation.